So over the time that we've had occupational therapy in the Years program, the range of project placements has evolved as the position has evolved, I suppose. So first of all, we sort of had students really doing some of the service scoping things about what other occupational therapists are doing in terms of what are they providing for Aboriginal and Torres Strait Islander families. So really around that broad service scoping kind of project that then helped us to understand who was out there and who we as a program needed to be liaising with. And then it sort of has progressed more to as our operational plan has been a lot more defined about the role of occupational therapy, then we've been able to find aspects within the operational plan that the students can then develop projects that feed into our outcomes in the operational plan. So an example of that is one that's actually on the website, is around the occupational therapy students reflecting on if I knew then what I know now. So when we, part of our operational plan is to look at how university curriculum can really be better addressing OTs working with Aboriginal and Torres Strait Islander people. So we were able to have the students reflect on their curriculum and then suggest back to the university about how the curriculum could be enhanced for them to be better prepared to work in a place like Deadly Years or like the Institute for Urban Indigenous Health. So to prepare the project placement, it's not like the student arrives on the first day and I just, make up something out of my head. I often talk to our clinical education support officer and work with them to really define what the placement is. So if I can explain it to them as a clinical education support person and they can make sense of it, then I know that it's going to make sense to the student, because we are, at WUs, we are a very non-traditional OT service delivery, so I need to make sure that the student's going to understand what their project will be. So often they'll have a few different projects so that they don't get tired of doing one particular topic. There'll be an aspect around sort of looking at the evidence and what's out there in terms of paper-based research. But in the area that we work, as an OT working in ear and hearing health, there's not a lot of evidence out there. So I also need them to be liaising and consulting with colleagues in our office and beyond to be able to inform their projects. Project placement for this particular setting needs to be clearly defined. The people that they liaise with need to be sort of set from the beginning so that they can build relationships with those co-workers, and therefore when they need those co-workers to support them for their project, they already have that relationship developed, and they can use not only me as their primary supervisor but our speech pathologists, audiologists, health workers, health promotion officers, nurses, anyone else who's around can be a resource for their project.